There are three major differences between hip pain from hip arthritis versus from hip bursitis. Let me explain them to you right now. Number one is the location of the hip pain. When it comes to hip arthritis, it's going to tend to hurt right in the front of the hip where the thigh meets the body. When you bring your leg up like this and your body folds right here in this area because your thigh is coming up, that's the location of hip joint arthritis. Versus hip bursitis, it tends to hurt on the outside of the hip, like right here, versus hip arthritis is right here, because that's the location of the bursa, which is what gets inflamed. That's what bursitis means. Bursa is just the name of the structure or the body part. And then itis, when they add bursitis, itis to bursa, that means inflammation of whatever it's attached to. And just so that you know, a bursa is a little sac inside of the body that's filled with fluid, and the point of it is to reduce friction between two things that are around it. So it usually is flat, and it's got a little bit of a space in the middle. And on the outside here, it's not as big as my hands. It's probably more like this big. It's helping tendons not to rub against the bone here on the outside. And so whenever you go to move your leg and do things and the muscle's having to move too because it's sliding back and forth, it rubs on the bursa, which reduces the friction against the bone so that you don't have irritation on the bone. But the bursa itself can become inflamed and irritated if there's too much friction going through that. So that's why you can get bursitis. Now that leads me into number two, which is swelling. Because when it comes to hip joint arthritis, you do technically get swelling, but it's inside the hip joint, inside the ball and socket joints. And because it's so deep, there's a lot of muscles around. You have muscles, abdominal muscles in the front, maybe a little bit of padding on the front too. You also have glute muscles in the back and muscles in the side of your hip. All of that covers up the hip joint. And so it's difficult to see and even feel the swelling that can happen inside of the hip joint. But on the bursa side, on the outside of the hip joint, the bursa is actually closer to the skin. There's a tendon or two covering it up. There's other muscles and things covering it up, but it's really close to the skin compared to the hip joint. And there are cases where on thin people, they'll actually be able to see a little circular amount of swelling that happens on the outside of the hip. But some people do feel like it's more diffuse, like it's more spread out swelling. And you can notice it. You can actually poke it and even feel like it hurts right here. And people will point to the bursa whenever I see them in treatment. Now, the third difference is the progression time. When it comes to hip arthritis inside the joint, it tends to come on more gradually over time. Now, sometimes you do get sudden spikes of pain, but usually there's been a history of achiness in the hip or pain in the hip of some sort. And it tends to affect people over the course of months or years. Versus bursitis tends to flare up suddenly, and it tends to be very related to some activity that's new or some overdoing it somehow, doing too much of something. For instance, the last patient I had that had hip bursitis, she was actually coming in for back pain, and her back pain got better as a result of our treatment. She had to clean out her garage because she was moving things around in her garage. So she spent a whole day lifting things, walking around, sweeping, cleaning her whole garage. And then when I saw her a few days after that had happened, she had hip bursitis happen because she was moving around so much. Now, she didn't have hip pain originally, but that happened as a result of her being too active and having some other issues, which I'm going to talk about in just a minute. Now, in her case, I told her you need to take some time off, let that calm down. It seemed to be related to the activity that you did. It's not an everyday thing. You're not going to be cleaning out a garage every single day. It's just a one-time thing. But when it comes to hip arthritis, what people usually will say is, you know what, I started this exercise routine. I've been doing it for months, and then my hip started to hurt. And then I stopped doing it. My hip got better. Then I picked it up again. Maybe it was a walking routine where you're going to walk a mile or two or three, maybe a jogging routine, maybe a weightlifting routine. And as you pick it up again, it comes back again. It tends to be something that's a more normal thing, something that you might do on a consistent basis, like at least a weekly basis, that feeds into the problem that flares up hip arthritis. And so some people will stop exercising, for instance, but if the problem persists over time, then it'll begin to happen, it'll begin to flare up with easier things, like even just doing chores around the house, things that you need to do every day. going to the store and walking around the store can begin to flare it up. Now let me answer the question that you might not think to ask, but what are some things that both hip arthritis and hip bursitis have in common? Let me tell you a few things. For one, they both can come on at the same time. It is very possible to get both hip arthritis and hip bursitis happening at the same time, which is a not fun situation to be in, because that means that you're going to have that pain in the front of the hip and pain on the outside of the hip. So it can feel like just everything hurts. It can hurt constantly. It can wake people up at night. It can keep you from walking around and doing what you need to do because everything is irritated and flared up. Swelling on the outside of the hip and inability to move the hip joint normally because the joint is irritated. The number two thing that both share in common is that they're on the same spectrum. Now what that means is if you're thinking about a line, a spectrum, and on the mild end you have hip bursitis because it's relatively a more mild problem to deal with. That doesn't mean that it doesn't hurt a lot. It just means that it's very treatable, it tends to go away, and if treated correctly, it won't come back for a long, long time, possibly never. Versus hip arthritis, if there's changes to the ball and socket joint, that's on that same spectrum, but it's a more severe thing, a more worrisome thing to deal with because it can have more lasting implications for your long-term health. Now, the reason why these are on the same spectrum is related to number three. They are caused by the same root problem. So it's the same muscle imbalance, a root problem that sets up hip bursitis, that if that muscle imbalance is not treated properly, of course, hip bursitis will continue to come back if you overdo it, but it's also going to set up bad movement at the hip joint. And over the course of months and years, then it begins to mess with the way that the hip joint works, and that can cause hip arthritis. And if that isn't corrected, then it will progress hip arthritis to the point where the cartilage on the inside of the ball and socket joint is affected enough that possibly a hip replacement surgery is needed. But now the good news before you worry about both hip arthritis and hip bursitis is that you can fix that root problem. In fact, we talk about it here on this channel all the time. We have a very good treatment approach, a very proven treatment approach that's helped tons of people come into our clinic as well as online through our YouTube videos and through our programs. This problem is related to that muscle imbalance, and it's usually weak glute muscles or glute muscles that aren't used properly, and then muscles on the front of the hip that are too strong. We talk all about this treatment approach in our hip arthritis program. You can learn all about it through the link in the description below. It's an online program that you can access from anywhere you have an internet connection, and it's anytime. You can access it anytime, and you can learn all the steps to fix an arthritis problem. Now, we've also got a playlist called the Hip Arthritis Help Playlist, which has all of our hip arthritis videos. They've also got hip bursitis videos. You can find links to those two playlists down in the description below as well. Now, I hope this video was helpful for you. If it was, please give us a thumbs up. That helps this video get out to more people that need to see this video. And speaking of which, if you know of anybody that needs to see this video, please share this video. Hit the share button below, send them the link, email it to them, text it to them, get it to them some way, somehow, so that they can benefit from this video too. And don't forget to subscribe and hit the notification bell so that you don't miss out on any of the helpful videos we have each and every week. And please drop a comment. Let us know what you thought of this video. Let us know if you have any questions. We'd love to get back to our comments. I'll see you in the next video. Bye-bye.